In the first section of our lecture, now we will talk about the glomus tumor of the middle ear and mastoid. In this section, we will talk about the classification of the glomus tumor, what's the etiology and causes of the glomus tumor, and what's the pathology of the glomus tumor. First, the classification of glomus tumor. For the classification, first we divided it into primary tumors and the secondary tumors. The primary tumors, usually they can be benign, and the benign are the glomus tumor. So glomus tumor of the middle ear and mastoid are the benign tumors. So primary tumors, they can be benign and they can be malignant. Benign tumors are less invasive, localized tumor, and they are less dangerous as compared to malignant tumor. And the glomus tumor of the mastoid and middle ear is the benign tumor. Then malignant tumor is the sarcoma and carcinoma. So primary tumors are the tumors which arise from the mastoid and the middle ear rather than spreading from some other area of the body. So primary tumor are further divided into benign tumors and malignant tumors. Benign are the glomus tumor, malignant are the carcinoma and sarcoma. Then secondary tumors are further divided into the tumors from adjacent areas, from nearby areas, are the tumors from nasopharynx, external meatus, and parotid gland. So all these for the tumors from adjacent areas that can spread to middle ear or the mastoid. And the tumors, metastatic tumors from the distant areas, or the tumors which are metastatic from the bronchus, breast, kidney, thyroid, prostate, and GI tract. So very simple classification of the tumors of middle ear and mastoid. We have first primary, which can be benign or malignant. Benign are glomus tumor, malignant are sarcomas and carcinomas. Then secondary tumors, again from nearby area or from adjacent area, which are metastatic. So nearby areas, usually we have nasopharynx, external meatus, and parotid. And then from the distant areas, like we have bronchus, kidneys, prostate, thyroid, all these can spread to middle ear and mastoid. Glomus tumor is the most common benign neoplasm of the middle ear. So benign neoplasm, glomus tumor is benign and is the most common benign neoplasm of the middle ear. If you see, that's how it presents on otoscopy. This is the diagram. Glomus tumor develop from paraganglionic cells which are derived from neural crest. Origin: glomus bodies resemble carotid body in structure, found in the dome of the jugular bulb or on the promontory along the course of tympanic branch of 9th cranial nerve. There are 12th cranial nerve, so this is from the tympanic branch, from the promontory along the course of tympanic branch of 9th cranial nerve. So the glomus tumor is the most common benign tumor derived from paraganglionic cells that arise from the neural crest. They arise from glomus bodies. Glomus bodies are same as the carotid body in structure. Two types of glomus tumor depending on their location. They can be in the tympanic and in the jugular bulb. So these are the origin of the glomus tumor. Next, the etiology and pathology of the glomus tumor. Is seen in middle-aged women 40 to 50 years old. So it's the disease of middle-year women, 40 to 50 years. Females are more affected than the males. Benign, non-encapsulated but extremely vascular neoplasm. So glomus tumor are extremely vascular. They are not encapsulated. They are not covered by a capsule. So they are very, very vascular, bleed easily because they are highly vascular. Masses or sheets of epithelial cells which have large nuclei and granular cytoplasm. So they look under the histological picture or microscopic appearance of the glomus tumor. There are masses of epithelial cells which have large nuclei and granular cytoplasm. Small granules are present in the cytoplasm of the glomus tumor. They are locally invasive, they are benign, so they invade locally, they cannot metastasize. So these are some important features of the glomus tumor. Highly vascular, the cells are sheets of epithelial cells with the large nucleus and cytoplasm is granulated. Females are affected more. It's the disease of the middle age, 40 to 50 years of age. Now, as we mentioned, depending on the location, it can be glomus jugulare in the jugular area, in the jugular bulb close to, and then this is the area where this glomus jugulare is present. So this is the glomus tumor, glomus jugulare. Arise from the dome of the jugular bulb, causing neurological signs of 9th to 12th cranial nerve involvement. So when glomus jugulare is present, which is present in the arise or develop from the dome of the jugular bulb, it affects or the signs which are or the signs and symptoms, signs which are present are mainly due to involvement of 9th to 12th cranial nerve. So there are 12 cranial nerve. We have olfactory nerve, which is the first cranial nerve, olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear. So our 9th cranial nerve is glossopharyngeal. Then we have vagus, accessory, and hypoglossal. So these are the signs are mainly due to involvement of 9 to 12th cranial nerves, which include glossopharyngeal, vagus, accessory nerve, and hypoglossal nerve. Then next is glomus tympanicum. One was glomus jugularum, which is arise from the bulb of the jugular bulb, dome of the jugular bulb. The other is this is the location of the glomus tympanicum. Arise from the promontory of the middle here. This promontory of the branch of the tympanic branch of the ninth cranial nerve. Cause oral symptoms. Oral symptoms means the symptoms of the ear, because it is from the tympanic branch of the ninth cranial nerve. Tympanic is the eardrum or tympanic membrane, and it can cause facial paralysis. So that's the location of the close in the middle ear, close to the ossicle, cause auditory symptoms, and it can cause facial paralysis. Spread of the glomus tumor. The glomus tumor spread it fills the middle ear and later perforate through the tympanic membrane. Labyrinth, petrous pyramid, and the mastoid. Jugular foramen and the base of the skull, causing 11th and 12th cranial nerve pulses. Eustachian tube and nasopharynx. Intracranially to the posterior and middle cranial fossa. It's a benign tumor, so the spread is very, very locally, not very distant metastases occur in this case. So it can fill the middle ear and then lateral on can perforate through the tympanic membrane and can spread to posterior and middle cranial fossas, eustachian tube, nasopharynx, labyrinth, mastoid. So all these are local areas are affected by the glomus tumor. So that was all about the glomus tumor and what are the signs and how different types of the glomus tumor and how from which cells it can develop and arise. Thank you for watching sqadia.com.